Aniset LA comes from years of bespoke development of IV giving sets designed and manufactured by Millpledge. They form part of the Animal range, which also encompasses superior small and companion IV sets. We would like to introduce you to the Animal large animal range. We have a 2 and 4 spike large animal giving set. They are individually packed and sterile for single use. They are available in units of 15 per case. This is the LA Express set, ideal when speed is of the essence and large volumes of fluid need to be delivered quickly. We also have the LA Extension set. Both 2 and 4 spike giving sets have superior large bore tubing, allowing infusion of high volumes of fluid. They are both kink resistant, minimising the risk of occlusion. Without a cannulae, they will run at 22 litres per hour, approximately 6 gallons. With a cannulae, they will run at 7 litres per hour, approximately 2 gallons. All the Millpledge giving sets can be used with colloids, crystalloids, plasma and drug administration, so ideal in cases to treat things like dehydration, shock and support treatment pre and post surgery. This is where most cases of fluid therapy is required. We're going to go through the features and benefits of a 2 spike giving set. We start off with black cable ties. This allows you to secure the giving set to the infusion bag. Black cable ties are very useful as you may need a little bit more security to hold onto your giving set bags, as they can be rather heavy. All the cable ties provided are reusable, therefore you do not need scissors, and this makes them very easy to undo, so ideal when you actually need to change the bags. You have an ergonomic finger grip at the base of the spike. This allows you to insert the spike with greater ease. Each tube has a blue bulldog clip. This allows you the choice of which bag you would actually want to use. This tubing is positioned so that the fluid bags run consecutively, i.e. the higher placed bag will run first. When it's finished running, then the lower bag will automatically start to run. This is ideal if you need fluids to run for long periods of time or overnight. Therefore, the 4 spike bag would prove even more convenient in these circumstances. The large red bulldog clip will clamp off and stop all fluid from flowing. Both giving sets have a rotating connector. This is a unique benefit as it allows a 360-degree rotation, allowing the horses to box walk without getting the tubing twisted or tangled. It has a 100mm burette with a float valve. The float valve can be seen from a distance, allowing you to see the fluid when the burette is hung at a height. On top of the burette you have an injection port. This allows medication to be administered if required. It also has a bacteria air filter. This assists when priming the giving set. Both giving sets have wide bore retractable spiral tubing. This is 150 inches long from the bottom of the burette to the lure lock at the end. This is extremely useful for the horse as it allows the horse to move freely around the stable block. The blue slide clamp allows you to shut fluids off. This is ideal as it's more accessible when the giving set is in use. The screw clamp is the roller clamp. This allows you to control your drips per minute. The giving sets also have reusable ties at the bottom. These are used to help secure the giving set to the horse's mane. Both sets have an accessible Y-port injection site at the distal end. They also have a swivel lure lock connection. This enables you to connect your giving set to a cannula or an LA extension set without the tube twisting. All the Animil giving sets contain a priming valve. This enables you to prime the giving sets with fluid without losing any of the fluid, however expelling all the air bubbles. This keeps your area and patients clean and dry at all times. We will actually demonstrate this for you. We're now going to show you how to connect and prime a 2-spike LA giving set. Before connecting the 2-spike giving set to any fluid bags, ensure that all your blue clips are closed. This includes the slide clamp at the bottom of the giving set. Also ensure that the cap of the bacteria filter on top of the drip chamber is firmly closed. We are now going to show you how to attach the giving set to the actual bag. Attach the spike assembly loosely in position using the black adjustable ties through the slots or the holes either side of the port of the IV fluid bag. Remove the end protector cap from the spike and insert the spike fully into the bag. Now tighten both black ties to secure the spike's position. Repeat the procedure with the second spike and you are now ready to hang your bags up. With the bags hung, we are now going to show you how to prime the giving set. For this procedure, we are using dye so you can follow the priming. The idea of priming is to fill the giving set with fluid, expelling the air bubbles without losing any of the fluid. This keeps the area clean and dry. Now we have filled the bags with dye, we will start to prime the giving set. We'll do this using the highest hung bag first, which is the yellow bag. First open the filter on the drip chamber. Now release the blue clamp on the longest arm. This allows the drip chamber to fill. Please note, only half fill the drip chamber. When you have the required amount of fluid in the drip chamber, please close the air vent. This will stop any more fluid entering the drip chamber. You will now need to invert the drip chamber so the blue float is buoyant. Now open the blue slide clamp at the bottom of the spiral. The fluid will now run all the way through the giving set to the priming cap. You can see the air bubble floating all the way through, right to the end. As you can see, but there's no fluid coming out of the end. This is because the priming cap stops this from happening. This leaves your area clean and dry. Now close your blue slide clamp and your screw clamp. Now close the red C clamp. Now remove your priming cap. This is now ready to connect either to an indwelling cannulae or a primed IV extension set which is already connected to an IV cannulae. Your IV cannula and extension set will obviously be connected to your horse already. So to begin the infusion, open the red C clamp and the blue slide clamp. Now slowly open the screw clamp and this will allow your fluid to run. The screw clamp is used to control your drops per minute. calibration may take a few attempts to actually master, however, it is a good idea to do if a greater flow accuracy is required. We are now going to show you how to calibrate the giving set. All the instructions can be found on the insert. The calibration will allow you to deliver a more precise flow rate. Take your 60ml syringe and remove from the sterile packaging. Withdraw the plunger and discard it. Now attach one end of the Anisette calibration connector onto the syringe barrel. You'll want to do this so the open end of the C-clamp is towards the syringe. Now close the red C-clamp and attach the other end of the Anisette calibration connector onto the end of the Anisette LA IV giving set. The object of the exercise is to use the syringe barrel as a receptacle to measure the time it takes to fill with a given quantity of fluid. This can be 10, 20 or 30 ml, depending on the recommendations of the flow table. The flow table is based on the spike head being approximately 50 inches above the infusion site. The calibration will need to be done with the bags in their final position and the calibration device at the average height that the IV cannula is likely to be. Holding the syringe barrel in one hand and using the other to open and close the red C-clamp, allow the liquid from the line to flow up the syringe barrel. Initially, fill the syringe barrel up to the 0 graduation and then stop the flow at this point. We are now demonstrating this calibration using a 20ml measurement. To do this, please ensure you have a timer and you will time this in seconds. Time in seconds the period it takes from releasing the C-clamp for the fluid to reach the 20ml mark. As soon as it has reached the 20ml mark, close the C-clamp. If you need to increase or decrease your flow rate, use the screw clamp to do this. When the fluid fills to 20ml in 14 seconds, follow the calibration chart seconds for 20ml. You will see that this will flow at a rate of 5 litres per hour, approximately 1.3 gallons, and 120 litres over 24 hours, approximately 31.5 gallons. We have also included bag run-out times on the calibration sheet, so the fluid rate set to fill up to 20ml in 14 seconds, a litre bag, approximately a quart, will run out in 12 minutes, and a 5 litre bag, approximately 1.3 gallons, will run out in 1 hour. We've gone through setting the LA giving set up with you, however we would like to go through some other points. One question that may be asked: can you change a bag of fluids or add a bag of fluids whilst there is a bag still running? This is not advisable because you will need to lower the bag system to change a bag or add a bag. Therefore, by doing this, you will change the flow rate on the running bag and this could cause inaccuracies. Another question: can one bag be used on a 4-spike giving set or a 2-spike giving set? Yes, it can. Just ensure all the unused tubes are shut off. Other major benefits of the Anisette LA range are having the choice of a 2 or a 4-spike giving set. This allows you to infuse large amounts of fluid without the inconvenience of adding components, i.e. piggybacking. You have a long coil tube which is 150 inches or 12.5 foot. This allows the patient to box walk. This also gives you another 2.5 foot longer than other well-known brands. The sets have kink-resistant tubing. This lowers the risk of occlusion. You also have large bore tubing. This allows vast amounts of fluid to be infused. The swivel connectors prevent the patient from becoming entangled in the tubing and the tubes from becoming loose. The priming cap is simple, however a major advantage, as it allows the giving set to be primed with fluid, expelling all of the air bubbles without losing any fluid. This keeps your patient and working area clean and dry.